brand new tool in the operating room is shortening the road to recovery for hip replacement patients. It's not a fancy laser or even a computer. It's an operating table. Fox 5's John Hanrahan has the story from Shady Grove Adventist Hospital.
John Vilforth has been an amateur photographer since he was 14 years old. In recent years, the retired Rear Admiral from the U.S. Public Health Service has suffered from debilitating arthritis, particularly in his left hip.
I love photography. I like to get out in the woods and I like to shoot, but it was hurting.
The x-rays confirmed the arthritis was bad.
Basically, he has limited range of motion, chronic pain, and difficulty with his daily activities to a point where it's interfering with his quality of life.
The recommended solution? A hip replacement. Orthopedic surgeon Sridhar Durbhakula specializes in minimally invasive hip replacement surgery. And to help him reduce the cutting, Shady Grove Adventist Hospital has purchased the relatively new Hana operating table, where the patient's feet are placed in what look like ski boots, and the physician can easily manipulate the patient's legs and ankles.
And the first step is dislocating the hip and getting proper exposure. And to do that, you need to be able to rotate the hip outward and apply gentle traction to separate the hip ball from the socket and do our preparation of the ball.
The Hana table gives surgeons the flexibility to manipulate patients' legs in many directions and angles during the surgery. That access means less cutting.
You have less muscle cutting, less destabilization of the hip, less bleeding, which leads to improved recovery with less pain.
The traditional technique of hip replacement surgery meant strict precautions on walking for 6 to 8 weeks. 80-year-old John Vilforth was walking in about a week. You're still limping now?
I'm still limping now, yeah. But we're less than a month from my surgery, and I'm still into physical therapy. I got to strengthen these muscles some more.
How's your pain now?
0.
A much faster hip replacement recovery because of a very flexible operating table. At Shady Grove Adventist Hospital, John Hanrahan, Fox 5 News.
The Hana table cost about $100,000. Now, when it comes to medical costs, that's not really a lot of money. Health insurance companies should like it because it cuts the need for pain medication and also cuts the need for post-operative physical therapy.